Hello guys, welcome back to my channel. Watch until the end of the video and do like, share and subscribe. Let's see how coronavirus affects the lungs. Severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2 is a viral infection that causes COVID-19. It quickly became clear that COVID-19 was very different than seasonal influenza with higher mortality and infectivity. The coronavirus spike protein is a multifunctional molecular machine that mediates coronavirus entry into host cells. Coronavirus attacks the lungs in three stages. Stage 1 Viral replication. Coronavirus first enters the body, then starts replicating itself rapidly in the lungs, creating the viral replication stage. The virus invades the cells of the lung, creating respiratory problems, ultimately filling the airways of patients with fluid and debris. Stage 2 Immune hyperreactivity. Immune hyperreactivity occurs on the progression of the disease. This is when the body's immune system identifies the viral invaders and send an immune response to clear the damage and to repair lung tissue. Normally, this inflammation response is localized to the infected areas, but sometimes the immune response is hyperreactive and kills healthy cells, causing even more damage. This can also make physical symptoms worse. Stage 3 Pulmonary destruction. In this stage, lung damage continues. In severe cases, respiratory failure can begin and patient may require the assistance of ventilators to breathe. The coronavirus spreads from person to person through respiratory droplets that are produced when a person coughs, talks, or sneezes. The virus enters the body through mouth, nose, and eyes. After entering the body, the virus spreads to the back of nasal passage and the mucous membrane in the throat. This passage conducts air into and from the lungs. The virus damages the lining and the body responds with an inflammation, which in turn irritates the nerves in the lining. That is when an infected person coughs. The virus enters a healthy cell and uses the cell to make new virus parts. It multiplies and the new viruses infect nearby cells. The coronavirus can infect the upper or lower part of your respiratory tract. It travels from the back of the throat down the bronchial tubes towards the lungs. The coronavirus can be more severe if the virus goes past the lining of the airways and reaches the alveoli. If they get infected, the sacs respond with inflammation. This inflammation can cause them to fill with fluid, pus, and dead cells. Lungs that are filled with inflammatory material cannot get enough oxygen to the bloodstream, reducing the blood's ability to take an oxygen and get rid of carbon dioxide. That's the usual cause of death with severe pneumonia. The body replaces the cells damaged by the virus with scar tissue, which is thick and stiff. This can result in a condition called pulmonary fibrosis, which has been seen in people with COVID-19. Three factors that affect the lung damage in COVID-19 and how likely the person is to recover and regain lung function. The first factor is disease severity. Severity of the coronavirus infection itself, whether the person has a milder case or a severe one. Milder cases are less likely to cause lasting scar in the lung tissue. The second factor is health condition, whether there are existing health problems such as COPD or heart disease that can raise the risk of severe disease. Older people are more vulnerable for a severe case of COVID-19 because their lung tissues are less elastic and they may have weakened immunity because of advanced age. The third factor is treatment. A patient's recovery and long-term lung health depend on what kind of treatment they get and how quickly. Timely support in the hospital for severely ill patient can minimize lung damage. Thank you for watching. Hope you guys like this video. Do like, share and subscribe and see you all in next video.